Good afternoon, everyone, and welcome to Getting In, a College Coach Conversation. I'm going to start with my opening plug, which is please, if you like this show, if you find it really valuable and helpful to you, leave us a review on Apple Podcasts. The more reviews we get, then the more people will be able to find us and also access our information. So appreciate if you would do that. We have, as I think we always do, a great show planned for you today. A big chunk of the show is going to be devoted to answering your questions. We've gotten a lot of good stuff from you on Instagram, on Facebook, directly to our email address. So we appreciate you sending those in, and we're going to do our best to get to as many of them as possible today. But before we get to that, we regularly, or from time to time anyway, and we ask people to come on and share their experiences in a particular profession that we know is interesting to many of the students that we talk with. And today, I'm particularly excited because we're talking about the nursing profession. And full disclosure, my mom was a nurse and actually taught nursing at our local community college for basically the entirety of her career. So I have a particular affinity for both the profession and the study of nursing. And so I'm thrilled to welcome not my colleague, but the husband of my colleague, Aman Kubrom, to the show today to share his experience in getting into a nursing program and then working as a nurse. Hi, Aman.
Hi, pleasure to be on the show.
Absolutely. Well, we're thrilled that you could take the time because I know that you're busy. As you said, you got off a shift yesterday. And so I appreciate you getting up this morning to speak with us today. And I thought we could start where all stories start, which is, what led you to nursing? How did you wind up in this profession?
Sure. So I should say got into nursing as a sort of second degree. I originally got my bachelor's in international affairs, and it didn't turn out to be as practical as one would say in terms of the marketplace.
Sure.
Nevertheless, it gave me, I think, a well-rounded liberal arts education, and I was working in Boston with homeless men and women, I guess, in the city of Cambridge. And I interfaced with quite a few nurses. I was a case manager. And so I was directly seeing the social determinants of health. That's a word for saying, how does someone's education, their income level, their access to food, nutrition, how do those things impact one's ability to maintain their health? And so I was regularly having nurse practitioners come in and do, education about diabetes and hypertension and, the effects of smoking. And that got me interested in sort of like nursing, really. I have family that are nurses as well, but I'd always kind of discounted it. And so it was really until I had my own professional exposure that I became more interested in it and starting classes at the local community college. Really fell in love with anatomy and physiology, and those sort of combination of experiences allowed me to successfully get into several nursing programs. And from there, on the job training.
Right. Absolutely.
Where I am now, I've been an ICU nurse my entire nursing career. So I'm going into my 7th year. And so it's been very rewarding, very exciting. And so many avenues of nursing that are, you can change. There's lots of flexibility in terms of specialties and where you want to go, and the ability to really have a meaningful, long-lasting career.
Right. And it's interesting that you bring up that ability to change and you've been an ICU nurse your entire career. I do feel like when we think about nursing collectively, you think about people who are in the hospital assisting doctors, right? And I think that I know that nursing is so much more than that. And I started to get real insight into that when I was an admissions officer at the University of Pennsylvania that has a nursing program. And I saw all the kind of cool things that students could do out of nursing, which I needed to learn about so I could talk to students about that possibility. And I just, what led you to settle on ICU as your area of focus? And do you see a path where you might choose something different in the future, and why?
Yeah, so I initially was interested in becoming a CRNA. That's
Hmm.
a sort of a graduate degree program in anesthesia that nurses can pursue, and that requires ICU experience. Um, and over time, I have kind of shied away from that just because I have loved the diversity of my experiences at the bedside. Uh,
Hmm.
and so, you know, anesthesia, love them, but it tends to be, certain things, and I get a lot more diversity in, the type of patients I'm going to see, what I'm going to be do, what my day is going to be like, and I'm a person that values diversity quite highly. I don't want to be doing the same thing day in, day out, and so
Hmm.
one of the rewarding aspects of nursing is that each day I may come in and my assignment may be different depending on the needs of the unit. Um, and certain nurses, let's say they're float pool, so these are nurses that are going to be every day, even maybe even in the middle of the shift, going to be their assignment may be changed, and they're going to have to adapt. And that's something that I really think is very crucial in, I think, just in life, being able to adapt to changing circumstances.
Right. And I can imagine that nursing requires that pretty much like you just shared, right? All the time, every
All the
day.
time. Yes.
Yes, got
Yes.
it. So do you see that it sounds like you are never bored as an ICU nurse. Do you see that there might be a time where you want a little bit less of the change, or for right now, that it would be hard to imagine giving up that diversity of the patients that you're working with?
Well, I'd never use the B word or the Q word, quiet, on shift, because nurses can be a superstitious bunch, but you never want to invite chaos.
Yes.
You just, and it's particularly, I'd say, with the pandemic, if the day is a little more calm, we like the words calm, that's okay these days. I'm okay. And there's lots of things you can do at the bedside. So I will, yesterday was a fairly calm day. So it gives you more of an opportunity to get to know what is going on with your patients, reading
Hmm.
notes, looking up the pathophys of what's going on, and you just could have an opportunity to learn. And I think the really exciting aspect of medicine in general is that um, it's a science, right?
Hmm.
And it's always an evolving science. So there's always an opportunity to learn, and different providers will have different sort of lens and perspectives. So you at the bedside have to kind of rectify one specialist saying we should pursue this course of action, another saying we should pursue this course of action, and you're kind of trying to say, based on my understanding, what do I think? And sometimes the role of nursing is to just have a let's reconvene everybody, and what is our sort of what is our plan for this patient?
Right, right.
All get on the same page. They'll have a little sort of care team meeting. What do we think is the most appropriate action? What seems reasonable? And there's a lot with medicine that there's an art, and there's a science and there's an art. And
Hmm.
there are lots of different ways. Is the adage says you can skin a cat, right? You can achieve the end outcome potentially multiple different ways, and that's where I would say a really skilled nurse can kind of view the whole picture and say, okay, we need to get these things done from the nursing perspective. um, what about if we try this? This may be in the best interest of the patient, or this is less onerous, or this is more feasible, or kind of looking at the whole picture and saying, yeah, that seems like we can all come up with a plan, or this is what the patient is expressing. How can we get closer to realizing their wishes or their wants?
Got it. Got it. That's really, and I think an interesting perspective about a nurse's role, what it can be in the process. What do you say if you're asked, or for people who are considering a profession in the medical field, but are very focused on being a doctor? And in your opinion, I guess what I'm really asking is for those students who are very hung up on the idea that they love medicine and they therefore need to be doctors, what is your take on being, the important role that nurses are playing that differs from what life might be like as a doctor?
I would say that these days in medicine, there's quite a bit more. One of the things is liability. I know that a lot of providers will talk about their liability about different things. And one of the freedoms as a nurse in my institution is I don't really think about the liabilities. I have a scope of practice, and I always have to think, is this within my scope of practice? So I can't order medications. I can't do things outside of my scope. Someone else has to do those things, but I can suggest these things and say, hey, I think this would be in their best interest. And it allows me to really focus right on the needs of, in my case, one or two patients. As a physician, you may have a caseload that anywhere from, if you're a hospitalist, maybe that's 15, 20, 30. And if you're a critical care doctor, whoever's in the unit, maybe that's, 10, 6. But you're looking at a much broader group of people. And I like honing in and focusing on, one or two patients. And so you really get to know them. That's where you spend the bulk of your time, is directly providing care, getting to know, talking with family, talking with the patient. And as a physician, you may not have that time to really invest in your patients. This is the reality of today's demands.
Right. So if one of your driving reasons for getting into the medical profession is to be in that helping role, to be in that care role, then nursing sounds like the role to be in. That's really going to put you right front and center with the patient. So thank you for that perspective that I think a lot of us don't always get. So in terms of, we've got students out there listening, or maybe parents listening and going to be talking about this with their students. What advice do you have for those who are thinking about nursing as a profession?
I think that one of the crucial things for anyone entering in healthcare is to have exposure. That's challenging, I know, for many, probably right now in the context of the pandemic, because in my institution, we're not allowing visitors. We've rolled back our visitor policy. So I'm not even sure we're allowing volunteers to come into the hospital, which means it'll be, you need to do quite a bit of fact finding. So asking your parents for colleagues, asking your friends, trying to talk with people in healthcare professions, be that respiratory therapist, allied health, physical therapy, occupational therapy, anyone that's really kind of, I'd say, involved in patient care is someone to be talking about what is it like, getting the information. Because there are lots of things that also, I would say, in the context of nursing that are less desirable, right? There's moral distress, as sometimes you're seeing things happen because people are, I would say many people are not adapted with this mindset that we will all eventually die. So sometimes futile care happens to people towards the end of their lives because people aren't ready to say goodbye. And so that can be distressing. Also deal with these days in healthcare, quite a bit of definitely emotional assault, but also physical assault. My colleague the other day was assaulted by a patient.
Eesh.
And so, there is violence, I would say, in the workplace. There is, and of course, all of the bodily fluids and functions that people may not like. So you have to, I think, get a good sense of what it is you're walking into. And I think that'll lend itself some credibility to someone that wants to, is applying to nursing school or to really anything. If you're going into medical school, being a scribe in an emergency department, even if you want to go to nursing, being a scribe, being a CNA would be something I would encourage you to encourage a person to look into.
And you took obviously a little bit more of a circuitous route to nursing. As you mentioned, it's a second degree for you. So there are obviously multiple pathways to nursing. any final thoughts, advice around that piece of things as students prepare to, many of them probably will apply directly to nursing programs. And these days, a lot of nursing programs require that you start in nursing. Um, so, that's a traditional path. I don't know if you have other thoughts about other pathways that people could take to nursing that you've seen maybe colleagues of yours do.
Yeah, I've seen people go get their associate's degree and then gradually get into the workplace or get into some workplace, so a nursing home, for example, and then work on a bachelor's and then move to inpatient settings. I think as many different ways you can get experiences valuable. I think in general, life experience, because we're talking about when you're caring for people, having life experience has been immensely valuable. So my interface, as I interface with people, right, that homeless case management, social services background is immensely valuable to me.
Right.
Because it's just, again, the ability to connect to individuals.
Yeah.
And get what are your needs? How can I help you? How can we advance your care? Because there's also a partnership, I would say, between the patient and the nurse. Hey, these are the things we kind of need you to work on. We need you to get out of bed today. It's going to be painful. I can help try to manage the pain through medications and through other things. But, you got to get out of bed because movement is medicine. And the only people that don't move are dead people.
Yeah. Ooh, that's a good one. That would work for me.
Yeah.
That would get me out of bed. Aman, thank you so much for joining us today and sharing your experiences and your perspectives on nursing. I really appreciate it.
Thank you. Thank you. And I look, if you want to have me back, this was fun. So I'd be welcome to come back if you'll have me.
All right, absolutely. Well, we'll field questions from our listeners and see if we can gather a bunch, and then maybe we'll have you come back and answer all of those for them. So you heard the man. If you have questions for him, send them in, and then we can have him back to talk some more about this profession with all of you. Right now, we're going to take a quick break, and when we come back, we're going to answer questions that are not related to nursing because you haven't sent those in yet. So don't go away.